أهلا بكم في تلفزيون CardioAlex. And with us now, Dr. Ali Oto, Professor of Cardiology from Ankara, Turkey. Hi, how are you, Doctor?
Fine,
Welcome.
and yourself?
Oh, yes, fine, thank you. Why is atrial fibrillation is important?
Well, atrial fibrillation is the most frequent arrhythmia in the clinical practice. Actually, its importance comes from because of mortality and also morbidity. And atrial fibrillation is the second most common cause of stroke, and 1 in 5 patients with atrial fibrillation do have stroke, and the stroke due to atrial fibrillation is much more devastating and very severe, and also atrial fibrillation causes increase in mortality. So these are important. The atrial fibrillation, besides this, of course, may lead to heart failure as well. So also a lot of problems in terms of quality of life, reduces quality of life. The atrial fibrillation is the main target, therefore, for the stroke prevention. And the main stream for that is, or the standard of care is, oral anticoagulation. That means we give blood thinners to reduce the risk of stroke. And for many years we have used the warfarin, and warfarin is a very, very tough drug with the therapeutic range, with the interactions with food and drugs, etc. So it's not easy to really manage. Now we have novel agents, so-called novel oral anticoagulants, and these are at least as effective as warfarin, with less intracranial bleeding, less major bleeding. And also those drugs do not need monitorization like warfarin. So nowadays we are in the era of so-called novel oral anticoagulants. Well, despite this fact, 1 in 10 patients who are on novel oral anticoagulants cannot continue with the drug because it's a lifelong drug use. So they, for some reasons, side effects, bleeding, compliance, they give up the drug, and therefore they are unprotected for stroke. So for those patients, now we have some other measures. There is a structure in the heart, in the left atrium, left atrial appendage, and it is believed that more than 90% of all the clots originating from heart comes from the left atrial appendage. So if you just close the ostium of the left atrial appendage, then you may prevent the stroke again. So actually we have the evidence for that. Those who are eligible for oral anticoagulants were randomized to left atrial appendage closure or warfarin, and then it seems that left atrial appendage closure is not inferior to oral anticoagulant use. And now, of course, there are controversies about the indication when to close the left atrial appendage, but the general belief is that if you have a patient who cannot tolerate or who have major bleeding with oral anticoagulants, then you may go and close the left atrial appendage. Or if the patient develops thromboembolic events, despite the fact that effective with effective oral anticoagulant, then again you may go and close the left atrial appendage. This is my actually topic this year in this Congress, and the title is Left Atrial Appendage Closure, Where Are We Standing in 2017? So during this talk this afternoon, I will just bring all the new data to the audience about the left atrial appendage closure, the new devices and how to implant them, and what are the results, what are the risks of left atrial appendage closure.
Okay. What are the best prevention methods to avoid stroke?
As I mentioned, the standard of care is effective oral anticoagulation.
Okay. What do you think about CardioAlex 2017, and is it meeting your expectation?
Well, I've been in this meeting for many years. I don't remember how many times I'm here. Well, every time I'm here, I see the progress of CardioAlex. CardioAlex has been a very important and major scientific platform in the region, and it is important for the cardiologists in the region, not only in Egypt but also the surrounding countries, because it is an opening to the world. It's an international scientific platform. So I strongly support CardioAlex for its achievement and for the future success.
Okay, and at the end we would like you to say a word to the people all around the world that to come to visit Egypt, and Egypt is safe. What do you think?
Sure. Well, I'm coming from Turkey. There are always, the myths about the Middle East. But now terrorism is an international fever. So yesterday, they had this very, very, tragic event in Manchester. Last month in Paris, the other day in London. So this is a global endemic and pandemic, actually we call it. So it's everywhere, and Egypt is safe, and I've been coming here for years, and Turkey is safe, Middle East is safe, but nowhere is safe.
Yes.
Nowadays.
Yes. Okay. Thanks a lot, Doctor.
Many
Welcome
thanks.
to Egypt. Thank you.
I hope that you enjoy, and see you next year. Bye bye.